Melinda, let's talk about burnout. I mean, I know it's not just in the nursing field, but it certainly is in medicine. And so, have you experienced that? And if you did, what'd you do about it? Because you've dealt with some difficult populations. I mean, geriatric, developmentally disabled, um, addictions populations. So,
Um, I think at the time, I probably didn't know it was burnout, but this has sort of been my history. When I felt like I had um, uh, entered a new population and felt like I had a good command of what was going on, and knew what was current, and felt like I put my best forth effort, I quite honestly would move on. I just I had a very very varied career, but it's the beauty of nursing. So if you dedicate
that's true.
your life to just acute care or in a hospital setting, even which I worked none of, but if you work in a hospital for 20 years, you can do so many different things in that 20 years. So nursing is a wonderful career where you can move around and change. Now, I think my changes were not small changes, but they certainly were helpful to me in keeping me fresh as a nurse, learning new information, and I feel like the populations that I served always had a better, enthusiastic nurse advocating.
That's funny. I agree with that because I was thinking, well, I didn't do that. But actually, I did in a way. Like, I stayed in psych, but what I did was moved around in psych. Like, I did patient and staff education when I wasn't being a floor nurse anymore. And then I did mobile treatment, which was, I loved. And then I was a nurse case manager in psych and then a psych NP. So I did keep moving around, even though it was in the same field. When I was feeling sort of burnout or bored, I guess is when I made the change.
Right, and it's funny you say that. I would probably have said I was bored, but in thinking about it, it was boredom and burnout,
Right.
and I just maybe didn't recognize it as such.
And the burnout is, I mean, it's not uncommon, right? They're saying the current studies 50% of American primary care physicians right now are admitting that they're burnout. I mean, I think the system, the insurance, I mean, it does set you up to not always be able to spend the time to do the kinds of nursing activities that really feel are most beneficial to patients. Being caught up in paperwork and all that kind of
Right, no time for enrichment, no time for CEUs, no time for research or whatever to help better yourself in your field. And so you're left feeling like you're not the best that you can be for the patients that you serve.
I think psych is, I mean, just because I've been in psych, I don't really know, but I definitely feel like psych can be super stressful. One of the things that as I dealt with personality disorders or um, anything that was very, very difficult, somebody who's acting out or someone who's manic and having a hard time coming down from that, is to try and remember how they got to that point, the things that happened in their lives that maybe predispose them to, you know, uh, to having a disorder. It that always helped me.
That is it's a wonderful tip that I wish I would have utilized along the way, because we all have had those patients, whatever, whether it's psych or addictions or long-term care or whatever, those patients that would stretch you, and I
Right.
think the that idea that you just threw out there would be very helpful for anybody who's struggling with a patient or a repeat patient or someone just difficult, is to remember what that they may had some earlier difficulties or?
Oh gosh, I remember one of the things that when I was working um, on the inpatient unit as a provider and having just a stream of mostly alcohol dependent older men who would come in um, because they needed detox, and it was sort of like a 3-day detox on the unit, and then we would be able to refer them to outpatient addictions or inpatient. But a lot of times, that was voluntary. They had to want to go, and a lot of times there would be certain people who would just come back again and again and again, and once they felt better, they just wanted to leave. And it was hard, and there were times where I really just felt, gosh, like just frustrated and, feeling sort of angry at the patient. And I knew that wasn't going to help their care in any way. And I don't know what made me think this, but one day I was working with this older gentleman, and I started thinking about him being someone's child. Him as a little boy, and I had boys, and so something about that, I used that for the rest of my time that I worked there, and it just brought my empathy sort of surging back. It was just a little technique, so I'll throw that out there.
I think that's a wonderful technique for anybody.
But also the tools that we've been talking about with you and the other nurses in terms of taking care of yourself make it less likely that you're going to burn out as well.
Right.
Right.
Good point.
Okay, thanks.
Mm-hmm.